Welcome back to the show, everybody. Well, we've talked a lot on this show about the physical and mental health impacts of climate change, but how is it impacting our kids specifically, and how can we help them? Well, our next guest has focused a lot of her work on exactly this question.
Yeah, she's a professor at Western University and the medical director at the Children's Environmental Health Clinic. Please welcome Dr. Anna Gunz to the social. Thank you so much for being here. Okay, so let's dive right in. So how prevalent would you say is climate distress amongst young children in this country?
It's a huge problem, and it's one that we're continuing to really learn and understand. And how much that intersects with other mental illnesses, we can't quite tease out. But one great study they asked 10,000 youth around the world from 10 countries, and 85% of them said that they were at least moderately concerned, and it very extremely was 60%. And they also asked, there was lots of themes about if they felt that there was any hope for the future, how did they feel about the government, did they feel they had a voice? And the other really, I think, shocking thing to a lot of people is there's another NGO in Canada, Earth Rangers, and they surveyed children 6 to 11, and it was very clear that eco-distress is something they felt. You know, as a mother of a 7 and 10-year-old, it's something that we navigate, but I think the person who said it best was my colleague's 14-year-old, well, she was then 14, and she asked her about it, and she said, Mom, you know, you grew up being told you can do anything. We're growing up being told the world's on fire.
Yeah.
Ooh,
powerful.
That one's big.
Powerful.
So let's talk about the impact. What are you seeing in terms of the impact on kids?
It's complicated. The way I think about it is there's obvious things and then there's less obvious things. So for example, if there's a big tornado sweeping through the area, if you're evacuated for wildfires, if you're in thick smoke, if there's flooding, you know, it's intuitive that people might have anxiety, depression, grief, and that's trauma, and that can lead to PTSD. But even taking that one example, there is a study that they surveyed an Alberta community that was evacuated. They surveyed grade 7 to 12 1 year later, compared to another group. And yes, they had more depression and severe depression, even suicidal ideation, which is shocking. But it was also things like more tobacco use, poor self-esteem and quality of life. And the other way is that climate change is complicated, right? You have heat, and that affects your mental health, or air pollution and the wildfire smoke. And air pollution, you know, the small particles actually get into our bloodstream and are associated with neurodevelopmental issues, but even mental health issues like depression, conduct disorder, as well as schizophrenia. And that's, I think, shocking to people, but there are a lot of examples in the physical and mental health like that, and people just aren't aware of.
Yeah, I had no idea. All right, well, you know, every generation struggles with their own angst and anxiety, but I have to imagine that it's really stressful for youth today because of just how much they know about the climate crisis. So have you found that to be true?
Absolutely. And Canada's very unique. So there was a UNICEF report card that looked at child environmental health of the 39 richest countries in the world. And by the way, we did terribly. We were 29, especially for things like how much greenhouse gases, how much garbage we need, how many planets it takes to sustain us. But one of the interesting things in there was our government spending. Despite that, we were only the 16th out of those countries, but our youth were the second most educated of all that. And so I think it's an interesting paradox where a lot of the time our youth are more knowledgeable than their parents, than decision makers and politicians and industry leaders. So for youth advocates who are trying to use their voice, they're often the knowledge experts in the room. And how do we help them feel valued and heard? And grown-ups should be listening and learning. And it's a very interesting dynamic. But that mental health that comes into the knowledge of what's actually happening is real. And then I say it now, and it might rub people the wrong way, but if you've never experienced it, you probably don't realize the true magnitude of the problem we're facing.
And you know of what you speak because you run an environmental health clinic for youth here in Ontario. And one of the priorities you have right now is, I find this fascinating, prescribing nature for dealing with climate anxiety. So why is that such a promising solution? Why do you do that?
I love this initiative. So it started with our Indigenous healing program. And so we call it land-based healing, nature for healing now. And so that's honoring where this knowledge comes from. But it's been such a positive. You know, it integrates mindfulness in all of the exercises, which is beneficial for mental health. It integrates this idea that if you care for and you realize how you're connected with the nature, you're more likely to work to protect it. But the other piece that's there as well is you know, this overall connection, there's so much literature about the benefits of nature to our mental health, to our physical health, even to children's learning and self-regulation, and how connected we feel with each other. And or putting green on a playground, how that changes how kids play, and, you know, if there's bullying and aggression. So it's combining all of those themes, and it's been such a positive experience to be part of.
Yeah, and Dr. Gunz, can you give us specific examples of what the nature prescription looks like for children?
So we're all about meeting kids and families where they're at. So, you know, what do you have access to? Are you only staying inside? Can you stay outside? And nature could be going on this big adventure, but it could just be sitting by a tree or putting your hands on the ground and feeling the earth, sitting outside and using all 5 senses. If you're with someone safe and you see someone who looks safe, wave at them. So I guess the social cohesion. And if you can't go outside, can you care for a plant? And that's what youth at our hospital really talk about, what they want to nurture and love. Or like, is there something flying in the sky? Can you see how many clouds there are? Can you count them? And so it's really integrating a prescription of, you know, how often are you going to do this and how many times a day, integrating mindfulness with the nature based on what people have access to.
Yeah, this is true. Okay, listen, talk to us parents here, Dr. Gunz. So your child is exhibiting this eco-anxiety. They're seeing stuff on the news. It's maybe happening in their own community. How do we talk to them about this?
It's hard. And as a parent, I've had these conversations and worries too. But I think the number one thing is validate. It's real, they're not exaggerating. Their feelings are real, and you will lose them right away if you dismiss it. And the second thing I think is really important is to explore those emotions. Like, what is it? Is it dread? Is it worry? Are you feeling helpless? You know, all of these pieces, and really pay attention to words like helplessness, because that doesn't help. You know, it's normal, normalize it. We all feel like that a little bit in a day, but it's always about trying to cultivate hope, because no matter what our situation is, we all need that. And then the other 2 pieces, I think it's about what we all do together with our kids as families. So one of them is this mindfulness. You know, you can fall down this rabbit hole and really, you know, and try to do everything and live perfectly, but it's too hard. So pace yourself. I say to youth advocates, you don't have to say yes to everything. And doing something small, starting local, but keeping your breathing as a family at the breakfast table, take 10 breaths together. Every time you go to the washroom, take a few breaths. Like, that's important, and integrate your nature prescription. And the other piece is, how do you give them agency? And that's through activism. So, you know, one thing we can all do with our kids, and our kids have a voice too, is go to your local, your provincial and your federal MPs, or write them a letter or an email and say you're worried. That's all you have to do. It takes 5 minutes. And then look for other things to do. So there's great organizations like For Our Kids, and it's actually for parents to help them with how do you advocate?
Yeah, I think it's great that we're having this conversation, because I think there are going to be a lot of people watching who had no idea this was an issue for young people. But looking forward, do you see climate change being considered and integrated more into Canada's healthcare system? Do you think we're ready for that?
This is a movement that's actively happening. And the way I look at it is the environment in Western medicine hasn't really been part of the conversation and dialogue, from when we see a patient coming to us, to how we prescribe and how we run our clinics. So, you know, at the environmental health clinic, and that's part of what we see, is kids with exposures or people who have symptoms and they don't really know why. So that's one piece. But we're also a massive emitter in the healthcare sector. So there's a lot of attention to how we actually should be doing better and work more sustainably.
All right. Well, Dr. Gunz, thank you so much for joining us and having this very important conversation.
Thank you.
Hey there, what did you think? Drop your comments below and join the conversation. And don't forget to like and subscribe so you can find more on everything from food and fashion to pop culture and current events. See you soon.